Hello everyone, thank you for tuning in. This is Sayer G, founder of GreenMedInfo.com, and today we'll be talking about turmeric and one of its primary constituents, curcumin, because it is the most heavily researched substance on our database. Just to get you a sense for how much research does exist, we're going to jump over here to pubmed.gov, which I encourage you all to search out and to use because it is the source for all of the data on our database. This is a public domain bibliographic reference source where you can look up to 20 million different citations using keywords, very much like Google. So it's sort of like the Google of medicine and life science related information. So let's type in turmeric and see how many results we get. Okay, as you can see, there's 1,800 peer-reviewed published studies on turmeric in the literature. You can click and get the free abstracts, and oftentimes there's a link to the full abstract, which can cost money to purchase. But thankfully, these scientists do a pretty good job of submitting a summary that will include information that gets to the heart of the matter. This particular study, actually, look here, in conclusion, our results suggest that turmeric extract can provide protection against the negative effects of aflatoxin on the performance of broiler chickens. Okay, let's go back. Now, turmeric is the whole plant, and oftentimes in the medical field, they're looking for magic bullet constituents. So curcumin has become sort of the favored constituent in this complex plant, which includes over 1,000 naturally occurring phytocompounds. So curcumin is the primary polyphenol antioxidant in turmeric, and if we type in curcumin and we search, we find 3,934 studies. Now, what we've done over the course of a month is we've looked at every single one of these studies, and we have indexed the ones that were compelling, that showed that turmeric had some medicinal value, if not proven, then potential medicinal value for disease. And this is the page, turmeric. We're going to show you how to navigate here first. So on the front page, you want to go to the substance index. You click that. It's an A to Z index. You go to T for turmeric. And you scroll down to U, and there it is. It's one of 1,300 substances we've indexed. And as you can see, it's been shared 1,991 times, so other people apparently find this compelling. Now, we have also enabled this page to be viewed without membership, which is a feature we are trying to promote because the resource as it exists today costs us $345 a month to just pay basic operating costs. So if you are interested in a membership, feel free. You can click on the left, become a member. It's only $295 a month. So we're hoping this will be a real grassroots movement where people can participate for a nominal fee and help make this free resource possible. But what we have done is pages that we feel are most important to get out to the public. We've enabled it so that you have all the features a full member would have. Now, as you can see, on top it gives you the article count. You have diseases count. So 569 different ailments are indexed across these 1,500 studies. And below you'll see them in a moment. Now, before we go there, I want you to see this one feature, which is limit articles by following study types. So let's say if you're only interested in the human studies, you can click this and you'll find just over 60 of the studies on the database are on human subjects. And we've talked in the past about why this is, and it's primarily because in order to find the capitalization required to embark on human clinical trials, it really requires an investor who is looking to get a return on his or her investment, or if it's a corporation, on the corporation's investment. And that is a fatal flaw when it comes to FDA drug approval, because patents are not available for natural things that you can grow in your backyard for free, as we all know, nor do natural things provide market exclusivity. So what that does is it's sort of like a kiss of death. In order to attain FDA approval as a drug, which is required for something to be used as a medicine within the established medical system, it has to be proprietary. And because nature does have her own proprietary formulas but doesn't grant patents, we are in a very difficult situation, because although if you look at any number of the studies on this page, and you'll see research indicating turmeric, for example, 169 studies showing it has antioxidant activity. And interestingly enough, in the context of a cancer model, you'll find that it actually has a pro-oxidant effect. So there's a certain selective cytotoxicity, they call it, with the herb being able to target tissue that, for instance, is not participating in a healthy way with the whole, and leave intact and protect tissue that is maybe undergoing oxidative damage, which could eventually lead to genetic changes associated with a cancerous phenotype. So the point is that there's a certain intelligence and, if you'd like, adaptogenic quality to this plant. We'll get a little bit into that in a second when we go through the Pharmacological Actions Index. So on the right here you see this column: article count 169 on oxidative stress, 51 on inflammation, 38 on lipid peroxidation, 52 on DNA damage, 61 on breast cancer. And what you can do is you can select just those articles that you're interested in seeing. So for example, let's take the 24 on colorectal cancer. You select those. It's going to focus these articles, and it will take a few moments because the system is designed to cache out or store in a static form the information whenever we make these selections. So it looks like I'm the first one to select just these 24 for focusing. So what that means is it's going to take us a little time, but the next person who does this, it should be rather rapid. Alright, as we're waiting a moment here, I'd like for you to see that we're dealing with all types of cancers that seem to succumb to turmeric. 42 on prostate cancer, let's see, 24 on liver cancer, let's see, 16 on skin cancer. And all this information is designed to make a certain argument. What I mean by that is that, we can't practice medicine because legally only a doctor can do so. And okay, now we have seen the filtering. Let me go back here. So you can see as we get down to the end of this list of over 500 diseases, okay, we filtered to the top just the 24 studies on colorectal cancer. Okay, so this is what makes the website unique when you're using the fully enhanced membership view, is that you're able to focus out parts of these 1,500 studies that you find most interesting. Okay, so we'll go back to the top. And so this is the real key to our database, is that we aren't medical doctors. We don't have degrees in medicine. We're users. We are trying to access, as we showed you, the peer-reviewed medical literature right off Medline. And this is the beautiful thing about our democracy of information, is that PubMed.gov offers for free the entire globe access to over 20 million index studies. So that's a pretty overwhelming amount of data. And what we've done is simply put it on one page and index it so that we get a certain type of argument. So if there's 169 studies indicating that turmeric has an antioxidant activity or helps reduce oxidative stress, that means something. And what we're doing is we're calling it cumulative knowledge. It's the accumulated knowledge on a certain relationship, and we're giving higher points to those studies that are human versus animal versus in vitro, and so on. And so the idea is that we're going to communicate evidence quantity here, article count, and quality in this score called cumulative knowledge. And that's what this whole box is here. Now, we're not trying to make the argument that if a certain disease isn't going to come up high on our list, then it shouldn't be pursued as a potential application for turmeric or curcumin. We don't want it to be a list that excludes what's not on the list, because that's one of the dangers. But what we are trying to do is amass the vast information in such a way that it's compelling. And what I mean by that, if we go to the National Institutes of Health and the National Library of Medicine's own interpretation of turmeric, and again, these are the two organizations that make possible PubMed.gov. So they're the ones who sponsor this and make it available to the public, so we thank you for that. But when it comes down to their interpretation, what is turmeric effective for? The only thing they say is it could possibly be effective for stomach upset. Okay, and keep in mind, this is a thousands upon thousands of year old remedy used for things as varied as boils to stomach upset to inflammation. And because we live in a system in a day and age where what science doesn't explicitly validate as being real cannot be considered to be real, we negate a thousand upon thousand year history of people using something because it works for them, and that's real to me. And so here you see a list of insufficient evidence to rate for effectiveness. Okay, and this is skin cancer, rheumatoid, jaundice, hepatitis, diarrhea, fibromyalgia. It kind of puts people in a void because it doesn't really give you much of a sense. Okay, well, how much evidence is there? And that's really what GreenMedInfo is about. Okay, here you see several references for their above statement, and you get about 22. Okay, so 22 references. What we're doing here is we're giving you 1,500 references. And like I said, it took several months to get to the point where we were able to exhaustively evaluate all of these studies. Okay, and I want to show you one thing that makes me really excited, is that if you look at cancers drug resistant, these studies are very important because although they are strictly in vitro, although maybe there is an animal study or two there, this is never going to become compelling or actionable to the conventional medical system, because if you are able to demonstrate something like a spice being therapeutic for a drug-resistant or multi-drug resistant cancer, that threatens an establishment that is it's beyond criticism. I mean, as of right now, the standard of care set down by the evidence-based model, which specifies that a human double-blind clinical placebo-controlled trial is the gold standard for determining the value of something, these in vitro and animal studies mean nothing. So I just filtered those to the top. Let me show you. Okay. But to me, it's very compelling. If there's 40-something studies indicating that a natural substance can induce, let's say, programmed cell death in a hormone-refractory prostate cancer cell line, or in retinoblastoma cells, which don't tend to respond very well to chemotherapy, or here's one for multi-drug resistant multiple myeloma cells, that's hugely promising to me. If I was in the position of facing conventional treatment, which had very poor prognosis for actually helping, and I knew there was something safe, and when I say safe, I mean this is something incorporated into diets of over 1 billion people on this planet, and it's being used on a daily basis as a spice. Well, it certainly would make sense at least to use it as a quote adjuvant, to use it with conventional medicine, and I can say that because there are a number of properties to turmeric that are extraordinarily unique, and this is where we get to the pharmacological index. So here you go. You have an herb that has been shown to have over 150 different pharmacological actions. We already talked about antioxidant properties. 230 articles that we've indexed thus far indicate it is an antioxidant. Here's a very interesting finding. 309 studies indicating that it's apoptic, which means that it induces programmed cell death in cancer cells, or cells like, let's say, in rheumatoid arthritis, which are simply devouring healthy tissue, and these activated immune cells that are expressing autoimmunity. So this property is extremely important because if you are trying to induce programmed cell death, it is reminding the cell that it's time for it to give up its individuality for the whole, to naturally, safely, gently disassemble itself, and to make room for new healthy tissue. So 309 studies, highly compelling to me. As you go down the list here, 75 studies on its chemopreventive properties, 48 on its chemosensitizing properties, which means if you administer a chemotherapeutic agent, some would call them chemotoxic agents, it would help those agents work better at killing the cancer cells. Anti-angiogenic for preventing metastasis or invasiveness of the cancers. Radioprotective, so if you're undergoing radiotherapy, another euphemism in my understanding, using, obviously radioisotopes that are released in nuclear disasters, but using them to treat cancers. Well, at least curcumin offers a radioprotective property. You also find 14 studies on its radiosensitizing properties. So what we're saying here is it not only protects healthy tissue from the, quote, therapeutic gamma radiation being applied to a cancer cell, for instance, but it also sensitizes that cancer cell to the radiation. So you see this diversity of action that within the conventional model of sort of monochemical magic bullets that are self-same, that don't necessarily exhibit diametrically opposed properties, it's fascinating to see an herb express what appear to be opposite actions, but within the same plant. And you go on and on and on. So this is why we're excited about this page, is that we feel by collecting all this data, we're providing the world with an extensive, exhaustive evaluation, and hopefully that will empower people to look back in their cupboards, in their refrigerators, in their backyards for the medicines that have been used since the beginning of time, and that have a margin of safety that is orders of magnitude higher than drugs that are being marketed to us as sometimes the only choice, and which may literally cost $100,000 per treatment. This to me is unconscionable, and makes it all the more important that we get grassroots support for making this information public. So thank you so much for tuning in, and I look forward to following up with another herb soon.